The Mesa Chamber of Commerce Inside Business Podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio. Our podcast is hosted by Mesa Chamber of Commerce CEO Sally Harrison. Please enjoy this episode of the Mesa Chamber Inside Business Podcast.
Hello, everybody. This is Jeff Bear from Bear Media Group, and I'm really proud to be here once again hosting this podcast on behalf of the Healthcare Committee for the Mesa Chamber of Commerce. Thank you, Sally. Thank you, Myra. Thank you, Caitlin, for all you're doing to help advocate for Mental Health Awareness Month, the month of May. This morning, we are here with Karen Rosner from KMR Medical Solutions. Karen has a very unusual business, one you probably don't hear a lot about in the marketplace. So let's start off with that. Karen, talk about your business and how it got started, and then kind of feed into what kind of an effect it can have in a positive way for mental health and mental health advocacy.
Well, good morning, Jeff, and good morning, everybody. I'm Karen, and it's with KMR Medical Debt Solutions. And the reason I got into this business is I've been into the medical field all of my life, and I mean all of my life. I've had a serious medical condition, went through that. My dad says I'm his $1 million child because I cost him $1 million. And I had medical debt, and then I became a social worker, and I was really focused on my clients' patients' medical bills, and I tried to help them reduce or eliminate their medical bills. I even eliminated $50,000 out of my medical bills at one time, and that's where I started my business. And I enjoy doing it. It's a challenge that I always accept, and when I help somebody, it's a lot of win-win, win for them, win for me. And I love hearing their voices afterwards when I tell them that their bill went from $13,000 to $147. And that's what I have done for a couple of my clients. And it's just a relief for them. And that's why I do what I do, is to relieve the stress for them. And they're able to sleep better at night. And they're able to concentrate on better things and to get healthy if they're going through a medical procedure, or if it's just stressing them out, affecting their mental health. They get to think straight again. And with mental health, the finances and the stress of the finances really does cause a lot of mental health with them. They stop eating, they stop worry too much, they don't sleep, and they just don't know where to turn. And
so your experience with this, have you had any specific experiences, clients that you've worked with where it was from a mental health issue that they had incurred the debt, and you were able to either get it eliminated or round it down to a workable number?
Yes, I have. I've had a couple of clients that have been in the hospital for medical and mental health issues. And sometimes the mental health issues were not covered. So I advocated for them. And I advocated well for them because their bills went down from like half or even more than half of what they actually were supposed to be charged.
And just, from a visual standpoint, when you see that happen with one of your clients, what does that look like? How do they react when they find out that obligation isn't this huge weight on their shoulder or this albatross around their neck? How does that affect them?
It affects them because they're worried. They don't know where they're going to get the money from. They don't understand why it wasn't covered, and they get stressed out. They get into panic. Like I said, they don't sleep and they don't eat. And then when they hear about me, either through word of mouth or on my website or through somebody else, I do radio stations radio commercials and everything every now and then. So when they hear that, they know how to get a hold of me. And when they talk to me, I let them know what I've done and how I can help them.
Why don't you tell the folks out there what your website is in case they want to reach out to you?
YourDebtFreeQuickly.com, and your is YOURE debtfreequickly.com.
Great. You know, when we were talking before we went on the air this morning, you had mentioned one client who said to you, you were her rock.
Mm-hmm.
Could you tell us that story?
Yes, I was working with her and her husband. Her husband had the medical issues, and unfortunately he passed away, and she got a ton of medical bills for him because he did not have insurance. So I was working through it. I reduced about $20,000 for her out of the $140,000 that she has, and I'm still working on it. But I would update her, and she goes, "Karen, I don't know what I'd do without you. You're my rock. You." And when I send her a text or an email, "Oh, we got this one paid off," and she's like, "You're doing it, and you're making me feel better and alive again." And it was helping her because she was getting stressed out about all the bills, and she was getting mad a little bit at her husband for not having health insurance.
What kind of a process is it from start to finish for you to work your magic?
It depends on the bills and who's it with and everything. It could be a week, or actually a month to 3 months process. And because a lot of the time I'm waiting to have them call me back, the providers or the billing clerks, and then I have to send them my paperwork, release of information, and limited power of attorney. I get a limited power of attorney, and it's only for their medical bills. I don't want their diagnosis or anything. I just want their bills, so I know what I'm dealing with.
That's very true. You're dealing in a world of HIPAA, so
Yes.
You have to be very careful about information going in and going out.
Right, and I talk to the people that I'm with. I have a locked filing cabinet at home, so nobody, and I live alone, so I have my office, and my office has a lock in it too. So,
You know, one of the things I was wondering is how you see literally the change in the person from that, if it's 1 to 3 months. Say it's a 3-month process.
Mhm.
Do you start seeing the change? That they feel that some of this relief is starting to come, and this burden is coming off my shoulder. Do you see that? Is it the first month, second month, or is it right at the end when it's official?
it's gradually, and it happens throughout the phase. When I first talk to them and let them know what I can do for them, I could hear a little bit of relief in their voices. And when I tell them, I give them updates as much as I have the updates. And I'm like, okay, we got this one down to half of the price. And they're like, okay. And they feel that they can breathe a little bit better. Now this bill is now not, I don't have to pay as much as this bill. And I save them money. And then when I'm like, all right, now I have a resource, and I just put in resources applications to various foundations that will help with the medical bills. And there are all kinds of medical bills, and even mental health bills. They help with those too, the resources. I fill out the applications, I send them to the client so they can sign them, and then I have a letter with that application. And it takes a couple of weeks, 2 or 3 weeks, for that application to go through. And once they have that done, then and I say, okay, they said you have a 75% discount. They're really relieved. So that's 75% off their bill, and it's more manageable.
So why do they take that off? What are you doing in your process? I don't want you to give up your trade secrets here, but what are you doing in this process to convince the debt holder that they should say, okay, so-and-so is a nice person, had some tough times, can't afford all this. They have to hear that every day.
Right, but I do it the heartstrings. Like I said, I've been in the medical field. I know what to write and how to write it. And also, it's the financial. When I lay down in the letter that they owe this one, this one, this one, and they were like, well, if we get a little bit, it's better than nothing.
So you're separating the bills individually.
Yep.
So there'd be a hospital bill, there might be a psychiatrist
Just
bill, there might be a surgeon's bill.
Yep.
So you're going after each one individually.
Yes. Yes, I am.
Is there any one of those fields that's easier to work with?
No, not really. It depends on the day I call them, and it's so funny. I say that, but sometimes it's like I get a lucky day, and they're like, "Oh yeah, we could help them." Yeah, and or others would say, "We just need this information from you, saying that we can talk to you." And because of my POA and limited power of attorney, they just need that information before they could even talk to me or even consider working with me for the client.
Do you find that you sometimes end up going back to the same people in the debt resolution departments?
Yes.
And in that sense, do relationships matter?
Actually, yes, because they know me. They've heard from me, and they're like, sometimes it's like, oh, Karen's calling back for somebody else, and she doesn't give up. So I don't take no for an answer. And they're like, okay, we'll see what we can do, work with you. And that's what they do.
You know, and going back to what you first spoke about when you came on the air today about how you started in this, what was the real trigger for you to get into this? Is a unique niche.
It is.
How did you say one day, you know what, this is what my life is going to be?
When I was able to get $50,000 taken from me, written off from me, and it was funny when that happened. I didn't believe it at first. I had the letter and I had my son read it, and then I had my friend read it. It's like, yeah, it's true, Care. It happened, and then I was like, well, if I could do it for me, I could do it for other people, and I have throughout my career. As a social worker, I've been a social worker for 38 years. And I mean, I had a patient that just had arm surgery, and her surgeon was in the network, but the assistant surgeon wasn't in the network. And I called the insurance company and let them know that she didn't have a say in this. The doctor did, and her bill went down to $500 right then and there. So
that's a great example of advocacy and
yes.
knowing where to go,
yes,
and who to go to.
Yep, and that's it. Because of being a medical social worker for the last 25 out of the 38, I know who to call, and I don't ask for, and I have not going with the clerk that answers the phone. I will even write to the president of the hospital, and I've done it many times.
Do they pick up?
Mm-hmm. And I have done, and I even went for my client. I found him on Facebook, and I messaged the president of the hospital on Facebook, and I got some reduction in her bill too by that.
So you're using social media against these guys.
Yes.
That's great. Good for you.
So,
well, you know, in closing today, what would you say is your message to folks out there in terms of, you know, Mental Health Awareness Month coming up here? How would you say that you know, what would you like, what's your message? What would you like to say?
don't add extra stress on yourself. Breathe through the whole thing. If you're getting medical bills, first of all, don't pay the first medical bill, because they don't know, the insurance may not have gone through, the deductions may not have gone through. So wait until you get the second medical bill. That should be your true medical bill. And then if you need help, ask for it. Don't go away just thinking that it's all on you. You could call them and ask them for a reduction. You could call them if you have any questions about your bill, and ask for an itemized bill. And make sure that you really compare your EOB, explanation of benefits, to your bill so they can combine. And because they like to duplicate bills, charges, and there's errors in codes that may be wrong. So, and if you have any questions, contact me.
Karen, you provide a really unique service that I think more people should know about, because so many people today have just drowned in medical debt and they don't know that there's another way. So good for you for starting up this business, and good for you for being a member of the Mesa Chamber of Commerce.
Thank you. And I enjoy what I do, and I will advocate for anybody that gives me a phone call.
All right. Thank you very much.
Thank you.
We'll see you on the next one.
All right.
This has been a Mesa Chamber of Commerce Inside Business podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.